piernas, culos. I want to show you a couple different ways to do an OA release. You don't have to feel rhythm at all. You know, if you're somebody who's afraid of doing heavy things in the head, cracking the head, that makes you nervous, this is the easiest, simplest thing I can show you, and it's also what I do the most. I want to be very clear. A lot of what I do is that they're very basic things that I do. I think I do a very good job at doing very basic things. I will reflect onto my martial arts days. I did not always look as I now look. There was a day when I was somewhat of a more in shape person, and when we would compete and we would see other really tough people compete and fight and whatnot, the tough fighters that I saw, there was nothing like what I saw Jackie Chan, Jet Li, Bruce Lee, spinning around, kicking the ceiling. It was nothing. It was this, it was one of these, and they were very basic moves, but they were done really strong, really fast. Now, you know, I'm in Thailand, so it's Muay Thai. They stick a knee right through you, and it's basic techniques, really hard, really well, really strong, really fast. It's nothing fancy. The fanciness comes in your skill. There are other fancy techniques, and when we do anterior midline techniques, we're going to, for those of you who are cranial sacral people, you've never seen them before. But most of my day, most of the time, is getting a very, if you don't get a good release for the OA, why bother sticking your fingers in here and pulling his medial plate out of his sphenoid, which is going to make his eyes pop out of his head. You're not going to like it. We will do it too in the advanced cranial. I'm going to show you crazy stuff. But if you don't get a good release here, you're wasting your time thinking about the cranial mechanism. So what I'm going to do is I'm going to hold as much of his head as I can, and I'm going to come just off the nuchal ridge with my fingertips. Okay, I'm going to come just off the nuchal ridge, and I'm going to cup his head. I'm going to exaggerate this. I'm going to push into the table so that it moves his nose a little bit toward the ceiling, a little bit rostral. And then I'm going to lean back in the chair and relax. And I'm going to wait for this to follow me, and it will. I promise you it will. What you will feel as far as dysfunction, before we get into the complicated dysfunctions, complicated nomenclature, this will be what you feel. You first have to know what normal is to abnormal. Abnormal will be having Connie's head, small head on the table, and you feel her head and you're like, this feels like a rock. That's how you're going to interpret, when I say small head, I mean compared to a basketball, my head, okay? So when you get, I'll get a baby on the table and I go, it feels like I'm moving a rock around here. And actually I'll show you a video. I will show, if we have time, I'll show a video of a treatment of a very sick baby I treated a few years ago in Hong Kong. Who was microcephalic, and you feel the head and you go, my God, it feels like I'm lifting a stone. If you're a good palpator, lack of movement will feel heavy to you. That's what it'll feel like. Stone head. That's what we jokingly said. So I want to get this moving. Well, where's it going to move? I want it to lift off of the atlas a little bit. So I'm going to lift him up here. I'm going to lean back. When I lean back, I'll exaggerate. You'll see me, I will test it by leaning back. One side is going to lift easier than another side. So whichever side lifts, I'm going to lean that way and take it with me. And then I'm going to lean back and take it with me. Peter, don't fall asleep. You look like you could actually fall asleep standing up and still looking at me. That would be very scary. With your eyes wide open, just in a sleep.
Better close it.
One of us has to get ready to catch him. Okay, so I'm going to lift up, lean back, and then don't force anything else. One side will start to feel like it loosens up. If it's this side, I take that with me. And then I take it with me. I don't give it back. Take. An alternate way that I was shown, and I think they're not showing this anymore, was to put this up on fence posts like this. Okay, like that. This will work. But let me tell you, this is painful. And I do this to people that are having, I've had patients with paraplegic migraine headaches. To get a migraine headache and they're paralyzed during that headache. Okay? I've done this with them, with people with brain tumors that have headaches. I'm not making the brain tumor go away, but headaches because of the brain tumor. They can't tolerate this kind of release. Even if it might help them, they can't tolerate it. This they can. Now, one other finer point. As long as I'm touching him in an appropriate place, I'm not somewhere where he has to worry, touch as much skin as you can always. When I said I want fingers here and fingers here, or fingers here and fingers here, the rest of the fingers, I want them all over him. Okay? It's not doing anything, but the more you touch him, the more you have communication with him. And that's what you need to feel cranial rhythm. Okay? So I hold his head here. There's no air space. I'm not doing this. Okay? So I'm going to lift up a little bit. I'm going to lean back. And I'm relaxed. I feel his left side start to come up a little bit. I'm going to exaggerate so you can see what I'm doing. I'm just going to follow it up. And I'm going to stay that way until I feel the right side start to come up. At what point do you stop? You decide. But it shouldn't be minutes. Shouldn't be minutes. One more thing I want to say. Babies, I'm doing this on every baby that I see. How am I doing? I'm doing it on, my youngest patient has been either 2 or 3 days old. My oldest patient has been older than dirt. Okay? So I'm doing this on a patient who's 2 days old. How am I doing it? 2 finger pads, tiny bit lifting up. That's all I need to do. Because that occiput is in several pieces. Your occiput starts from 4 ossification centers and then comes together. But in a baby, it's in several pieces. No need to lean back. You only need to lift. Okay? This should feel pleasant. Your patient may experience a headache. That's a result of you doing it. I'm not afraid of getting a headache if it's in the course of doing something therapeutic. Okay? So this should feel very pleasant, handheld, real important. I want everybody to get a really good release. And I don't want you to get off the table because I'm going to rotate just one time. So everybody gets 2 heads. One head like Connie's, 1 basketball, 1 football. Okay?